Tonight, I would like to go back and talk about toning cranial nerves. And in this video, I will present you the information about cranial nerve 6, also known as abducens, and some of the exercises that could help tone it and the muscle that it innervates. Cranial nerve 6 is one of cranial nerves responsible for extraocular movement of the eye, briefly mentioned in one of my older videos, along with cranial nerve 3 oculomotor and cranial nerve 4 trochlear. Specifically, abducens allows for abduction of the eye or lateral movement. That's the same thing. That means the same thing. And it is a motor nerve only. It's not sensory. And the muscle that is innervated by it is called lateral rectus. This muscle turns the eye away from the nose. So this allows us to move and look to the right, with our right eye, and to move to and look to the left with our left eye. The cranial nerve 6 is particularly vulnerable to injury because it emerges at the cerebellopontine angle, and you could see that on the diagram in the post section on this channel. And also it has the longest intracranial course, which I also put diagram for today for you to see. Loss of function in this nerve can result in cross-eye. So the toning exercises that AI actually lists are primarily for strengthening the lateral rectus muscle, but they could also be used for other muscles that move the eyeball. The ones that are listed are cardinal point exercise, eye rolling, blinking, figure of 8, pencil push-ups, cheek and nose exercises, as well as lip exercises. And if you Google toning cranial nerve 6, the AI will provide you with these exercises, description, and the names. And I do agree with those being helpful. I also want to tell you that the duration that is listed is up to you, and building tolerance is always advisable. Please also, of course, consult with your care provider, especially if you have any eye condition that might be affected by you doing these exercises. The one exercise that I would like to demonstrate for you actually involves a series of steps, and it might be familiar to you because some of the experts online provide this as a way to re-regulate autonomic nervous system, and they say that it's actually the way to tone cranial nerve 10, biggest cranial nerve. I'm not exactly sure about that, but all cranial nerves are connected. That's what I can tell you, that I know to be true, and they all affect and send messages. So this exercise involves eye movements, and so it's pertinent to this topic. So I will demonstrate it for you now. First thing you want to do is just find a comfortable space, either standing or sitting down, and you want to focus right in front of you on whatever it is that you like. If it was a daytime, you could choose a horizon line. And then you want to feel your feet on the ground. Try to feel into your presence, either feeling yourself sitting or standing. And then what you would want to do next is choose a side that you would be moving your eye gaze to. I will start with my right side. Without actually moving your head, just turn your eyes to one of those sides and hold it there for like 30 seconds. And as you're holding it, just try to notice any changes you might be feeling inside your body. Does a sense of ease come on anywhere? And as you're experiencing this, just try to see if your head and neck wants to turn in that direction without actually exerting any effort to move it. And then just slowly bring it back, your head, to the midline. And let go and release the focus so you could give yourself a break. After this, we're gonna try and do the same. Actually, not try, we're actually going to do it with our other side, with, in my case, the left eye. So I'm just gonna shift my gaze to the left without moving my head and hold it there for about 30 seconds. And I'm just gonna allow my neck and my head to move. They wanna move. And notice what's happening there. After that, I'm gonna bring it back to the midline again. And so what many people have noticed with this exercise is a shift in the state of their nervous system. I'm curious what the experience was like for you. And As always, I'm inviting you to share your comments, questions, and concerns with me if you'd like. I want to emphasize with this particular nerve that I find it quite important to be there for our survival because it allows us to scan the environment, the periphery, and when our head moves, we also scan the space on the back of us, which allows us to see if it's safe for us to be in that space and with whoever or whatever is there. I just wanted to add that to overall, health of nervous system, because many people talk about vagus cranial nerve 10. I'd say all cranial nerves are very important for us and for the function of our nervous system. And I want to add the video with that. As always, please don't hesitate to reach out. Thank you.